The results, we have 38 children, median age of 20 months, ranging from 80 to 42 months, and 38 controls, all assessed by this Bailey scale. We had an echocardiography in 24 children. We do not have echocardiography in all 38 because doing an echo of the heart in a child of 18 months is not so easy because the child is just moving the whole time. Most frequently, maternal cancers were breast cancer in 61% and hematologic cancers in 22%. Chemotherapy consisted on average on 4 cycles of chemotherapy with a range of 1 to 7 and 3 different types with a range of 1 to 5. In fact, more than one type of chemotherapy was administered in 91 cases. Here we see the cardiac data. We will not go into detail, but what we see at the left are actually different parameters that echocardiographists are using in order to assess the health, the function of the heart. And we see the study children here, control children, and we will not go into detail into the numbers, but what I can tell you, we see some differences, but never these differences are clinically relevant. So if we discuss this with cardiologists, for them these results are reassuring. This is the most important slide. We see right at the top, we see the proportion of children and their outcome, their mental developmental index. In orange, we see the control group, in blue, the study group, and in fact, there is a nice overlap between these two. We could not see any difference in Bailey scale development in children antenatally exposed to chemotherapy or not. At left, here, we see actually again in blue the study group. Here the results are compared, the mental development index is compared to the gestational age. And there we see that children who are antenatally born are in fact doing a bit worse when compared to children who are born term. But the most important message is here that this is the same for children who have been exposed antenatally to chemotherapy or not. So prematurity is a problem, but not chemotherapy.